Good morning and welcome. Today we are going to continue with foodborne diseases and we'll pay particular attention to foodborne outbreaks. We'll look at what is an outbreak. We'll look at the general investigation to determine an outbreak, what you should do as a lab scientist, what you should do as a public health official to collaborate in the identification of foodborne outbreaks and management of these outbreaks. Uh, the aim is to ensure that we limit the spread of the outbreak and avoid future occurrences. So to begin with, we want to define a foodborne outbreak as a disease occurring in two or more people having consumed the same foodstuff or foodstuff containing a particular either a pathogen or a toxicant, as we identified in the last class. So when we see two or more people reporting with the same symptoms, and we trace it to the fact that they had consumed the same food or food from the same source, is that the same food or food from the same source, we can already be looking at the potential of a foodborne outbreak. There are different settings where this outbreak could originate from. A restaurant, for instance, where a food vendor is either preparing or serving food in very unhygienic conditions, or even at popular areas. For instance, when you're traveling, if you travel from Bamenda to Douala or Boya, there is a popular spot at Melon where you always want to eat maybe meat or a food or chicken self. So if we realize that a particular vendor at Melon sell food to passengers that came from a particular bus, and more than 3 of those passengers are reporting with the same symptoms within a short time, could suspect an outbreak originating from that vendor. So just have that picture in mind. To manage this outbreak will depend on so many factors. First, the cause of the symptoms. Remember in the last class, we identified that there are two distinct types of foodborne diseases. We have an infection and an intoxication. I also identified the duration of the incubation period and the clinical signs and symptoms. So the management as well will be showing these patterns. A pathogen, a foodborne infection, will require treatment with an antibiotic or an antimicrobial, while a foodborne intoxication require what? Treatment with an antitoxin, an antidote, or whatever to neutralize the effect of the toxin. But I must note that in general cases, in most cases, you always have these symptoms and they will be self-limiting. They will go on their own. They will disappear after a while. And if if we must recommend something, we'll always want you to take oral rehydration salts, especially if you are vomiting and having running stomach or watery diarrhea. If you're having severe diarrhea or vomiting, sending out fluids, you need to replace this fluid. So you can take oral rehydration salt. I'm sure all of you have an idea how to prepare oral rehydration. So you can prepare right at home. You don't need to buy. Prepare right at home and take. Most of the times, it is going to reinstate the fluid that is lost, the electrolytes that are lost, and then you recover from the infection or the intoxication. But in some cases, it might get severe. and you need medical attention, severe medical attention. As indicated, medical attention will rely on first the identification of the causative agent of the symptoms so that appropriate management measures could be taken. So the main focus of today's lecture is to investigate an outbreak and report. And I mean, how do we investigate an outbreak and how do we report to ensure that we are able to contain the spread of the outbreak and also to to prevent future occurrences of that outbreak. That is therefore the main objective of investigating an outbreak. So I'll take you right to Bamley. We could identify that there's a vendor, a food vendor at Bamley, maybe 3 corners, who is selling food that is contaminated. So if we report through 2 or more students, if we identify 2 or more students who are already reporting with symptoms after consuming, maybe purchasing soya from that popular soya man at the junction there, if we don't identify those students and trace it back to that soya, it will mean that every person buying soya from that place, maybe that day, is going to go down with the symptoms. That is a typical scenario. So the ongoing transmission is going to persist. If it is an infection, there's a risk of what? Of spread between victims. Remember, we said infections can be communicated from one person to the other. So we are assuming that it is a cholera outbreak, for instance, that will trace to 2 students who consumed food or soya from that, who bought soya from that vendor at the 3 corners. So those students, when they go to their homes, they are going to maybe interact with people in their houses and maybe begin because of, I mean, when you have diarrhea, you know how often you visit the toilet, and if you are not very hygienic, you know how nasty things can get. So you could touch, contaminate door handles, you could contaminate utensils, the taps, and so on. So door handles, everybody who is touching that door handle without washing the hand and eating is already going to pick the infection. Everybody who goes to the tap to fetch water from that public tap where you opened with your hand and didn't wash your hands well is going to pick the infection. So within a very short time, you see that the infection is going to spread across. So that is one of the reasons why we investigate a foodborne outbreak, to limit and contain the spread of the outbreak. And the next reason is that the next objective is that we want to prevent future occurrences. So was it that the person is preparing the soya under very unhygienic conditions? If we identify that, we can either report him for public authorities to ban him from selling, or we can recommend more appropriate hygienic measures for him to employ to prevent that. So those are the rationales for doing that. So I'll try to explain some of them point by point. I've already spoken of controlling ongoing outbreaks, and we can also want to dictate and remove the implicated foods. So I've already said that if we identify that is the soya man that is the cause of the outbreak, we'll need to stop him from selling further. We remove that food immediately, and then we can now go to further measures to prevent him bringing contaminated food again to the junction. But the current food that is contaminated has to be identified and removed from the supply chain. We could also want to identify specific factors that are related to the host, the agent, and the environment. So we could want to see if there are a particular group of people that are going down, because we are not sure that everybody who bought soya from that place is having foodborne disease. It's really not the case. So who are those who are easily affected? Maybe it's based on sex. Females are more affected, or maybe it's based on age. The elderly or the young are more affected. The next thing is which agent is causing this clinical presentation? Which agent is implicated in the symptoms? Is it a bacteria? Is it a virus? Is it a protozoa? Is it a toxin? Is it a chemical? That is what we want to identify as well. And then the environment that's implicated. Is it because he's selling in uh, open atmosphere? For instance, you must have noticed those who sell chicken, that the chicken is usually more or less a microphone. As they carry their chicken, chicken, chicken in front of their mouth. And is that what permitted the contamination of the food? So those are the things that we want to identify and take appropriate preventive measures against. We also want to identify the factors that contribute to the contamination, growth, survival, and dissemination of the pathogen. I've already indicated factors that are implicated in contamination. Maybe he bought food and transported in a poor condition. He was selling in open atmosphere. He was preparing food with contaminated water or in a very unhealthy environment. Those are all things that could do that. Then the growth of the pathogen, the growth and survival of the pathogen. Is it because the food is not served hot? I suppose that soya is really served hot, but not the chicken that is sold in public places in Bamenda. The chicken that you find being transported across the cities and across the agencies is not sold in open place. So when it's chilled like that, it's a permissive environment for the growth and survival of the pathogen. And how was it easily spread? How was it easily disseminated across the community? Is it just as people bought and ate, or there was another means? It was exposed maybe to flies, and flies were visiting the food and visiting other areas, and then moving the pathogen from one place to the other. Those are things we want to identify in the course of that. Again, I said we want to prevent future outbreaks and strengthen food safety policies. So in some cases, uh, we'll have to stop the vendor from selling entirely. In European countries and Western countries, they'll go further to order a recall. They go further to order a recall of the food at the expense of the industry implicated. So imagine that. I'll take for instance, there was an E. coli outbreak some years ago, originating from Spain, in the implicated in this lettuce, the lettuce that are commonly used in salad. So the farmers had transported the lettuce across Europe and even across the Atlantic. And when they identified that the lettuce was contaminated with E. coli or was infected with E. coli, the European Union ordered for a recall of that lettuce. And it means that the farmers had to pay back the price of purchase. So each person who had bought that food, the farmer had to refund the money. And secondly, the farmer had to pay for transportation of the food back to his farm. So when you imagine those costs that will come with if your food is implicated in outbreaks, you do everything in your power to limit contamination of your food. We want to develop policies that will limit the spread of food outbreak and strengthen food safety. For instance, if we have identified that the way food is processed, maybe the way cattle are slaughtered in an abattoir is leading to high contamination of the meat, we could design a more safe processing abattoir for meat so that we don't have contaminated meat in our kitchens. If we realize that the way cattle are transported or the way vegetables are transported is the main principal source of their contamination, we could develop a policy that would guide the way vegetables should be transported across cities, the way cattle should be transported from the farm to the market, and so on. So those are some of the outcomes that could arise when we do a proper investigation of a food outbreak so that we can prevent future occurrences. We may also want to acquire epidemiological data for risk assessment of the foodborne pathogen. Again, we'll be interested in where was the outbreak, when was the outbreak, who were those implicated. So if the outbreak is common in melon, then we might have to do something to prevent outbreaks from melon. So for instance, they may design a more appropriate selling position or selling method of meat at that point, or they may totally ban the sale of meat at Milan for those who are traveling. Is a possibility. If we realize that the young and the elderly are more implicated with that, we could do a general guideline to advise them to avoid purchasing meat at Milan while they are traveling because they are more vulnerable to this outbreak. Maybe people who are HIV positive with weakened immune system, as pregnant women, those are groups that want to find out if they are more vulnerable to the situation than others, and then we'll have a policy to guide that. We also want to stimulate research to prevent future occurrences. Of course, all of this, before we can have a strong policy to guide something, it must be research based. So we'll have to research and really be able to implicate a particular habit, a particular food, or a particular pathogen in the condition before we can make a policy to guide and prevent future occurrences. We must note that the scale of the outbreak might be very small, maybe restricted only to Bambali, or restricted only to Bamenda, or restricted only to the Northwest, to a bigger outbreak. I mean, taking down the entire country, or even crossing across the borders, affecting other countries, like the E. coli outbreak I just mentioned in lettuce. So, these are situations that could be very serious or could be very minimal, depending on how the initial management stages were handled. If we fail to handle it well, you get it getting very, very out of control, especially with pathogens like cholera. I'm sure you often hear of cholera outbreaks being reported, and there's already a very prompt and reactive mechanism and response mechanism as well. Immediately we identify a cholera outbreak because it is very virulent and spreads very, very fast, very fatal, and so on. So whatever the scale, we always want to do a full scale investigation to identify epidemiological factors, environmental factors, and perform a thorough laboratory investigation and further research. So there are 8 steps that are involved in this investigation process. 8 principal steps that I think that you should know and have an idea of, so that you have a comprehensive knowledge of the process. The first, I'll go through one by one and explain this. The first is collect initial information about the number of cases and report this to the appropriate health officials or district service. So we're saying that you've just identified, maybe in your laboratory, 2 or 3 people reporting with the same symptoms. And in the course of questioning, you realize that they consume food from the same source. The first thing you need to do is report this information to your nearest district health service. I'm taking the typical case of Cameroon. You need to report to the nearest district health service. I think there's a more appropriate way to rapidly communicate this information now with health services in Cameroon. All health services in Cameroon are linked to WhatsApp groups, and there's also the DHS2 portal. I think I'll be taking you to the portal to see how reporting is done on the portal because of this lecture. But DSS2 portal is reported, it captures information weekly and monthly. But an outbreak, we cannot wait for a weekly reporting to trace. If it's cholera, it should have gotten out of hand, it should have gotten out of control. So outbreaks, we need to alert immediately. So immediately you get it, you need to either place a call or you drop a WhatsApp message to the district health service so that a full-scale investigation could be initiated, and the restrictive measures put in place to contain the ongoing transmission and also prevent future occurrences, as we highlighted at the beginning. After reporting, The service, in collaboration with you, will now to develop an initial case definition. In this case definition, we want to identify who is ill, where are they from, or where did they get ill, what are their symptoms, when did these symptoms begin to appear. So if we identify the people who are ill, remember, we could be interested whether it's a particular gender, it's a particular age group, it's a particular immune group, a particular group with a certain condition, maybe pregnant women. If we identify that, now where? Was it in Bambili? Was it in the city of Bamenda? Was it as we're traveling from Bamenda to Boya? Those are things that will guide us in further investigation. What are the symptoms? Remember, the presence of fever will already guide us towards what? A foodborne infection. The absence of fever will already guide us towards what? A foodborne intoxication. When did they become ill? The duration period. Remember, a foodborne infection has what? A longer incubation period. A foodborne intoxication has what? A shorter incubation period. It's already directing us to which line of thinking will be more appropriate as the causative agent of the disease. You record all this information, including the age, the gender of the people affected, and then you develop what we call an initial questionnaire. An initial questionnaire will help determine if there is a common source of contamination. For instance, everyone infected ate the same food or ate food from the same place. Okay, there are two different things here. If it's from the same food, then we could be implicating the food. If we ate food from the same place, then it should be an issue with the restaurant, for instance. So we want to find out, is that the situation or what was the situation? So when we get that, we get there are common questions that should appear on your initial questionnaire to guide the investigation. Demographic details of the person. Demographics say we're talking about the age, sex, location, maybe occupation, maybe I mean all those stuff that will bring an idea of who the person is. All those things that will help identify the person should be captured in the demographic details. Then we get the clinical details. What are the symptoms you're presenting with? What is this? What are the severity? What is the duration so far? When did they begin to appear? We get all these clinical pictures captured together. And then we find out if the person has visited a healthcare provider or a hospital. It is this common place that when you feel funny, you go to the nearest pharmacy around you or the nearest drugstore, let me call it the way it is, the nearest drugstore around you, and you purchase whatever and you start taking in an attempt to contain the symptoms. So the importance of getting this is because if it's a foodborne infection and you have already started taking antibiotic, maybe a culture will not be able to identify the pathogen again in your stool because the antibiotic has already started acting on it. So it might mislead us if we don't get this information and then we don't identify the pathogen in the stool and we conclude that there was no pathogen. So it might be misleading. So we need to know if we have started taking any medication and what medication was it, so that we know what the effect of the medication could have been on the sample that we are analyzing in the laboratory. Then, of course, we are conducting a laboratory test on your sample to confirm if there's a pathogen in it or there's a toxin that is causing the infection. So, no, I'm not saying that we're conducting, I'm saying that we're asking if you have had a laboratory analysis and what was the pathogen that was confirmed. If you have not had any laboratory analysis, we'll note it. If you have had it, we'll note it. Because if you have had it and a pathogen has been implicated already, it helps us limit our scope of thinking of what the problem could have been. We'll also find out from the person in the questionnaire if he or she has had contact with other ill persons. Okay. Have you seen any other person who is presenting with the same symptoms? Did you have any contact with a person? And have you had contact with all other people that might not have been presenting with those symptoms? It is important in what we call now contact tracing. We also find out the food consumption history of the person. What did you eat yesterday? What did you eat this morning? What did you last eat before feeling these symptoms? this will help guide us to a particular implicating a particular foodstuff, a particular area in the infection. We also want to find out if there's anything you have in mind that caused the illness. It's very common that when you are having those symptoms, you always implicate a particular food you consumed. Okay, a lady that is presenting those symptoms in the morning will always remember that there was a particular fish that she ate, and the fish could be the problem. You always think that maybe it's that vegetable that you ate. You always think that maybe it's this. So it is good to have the thinking of the patient so that it will help us in guiding. The patient always suspects something that could have been causing the disease. And if we take it down, and from 2 or 3 people, we can be able to already have a preliminary result on what the causative agent was. And they will also find out if they know other people who are presenting with the same symptoms. I will again use ladies here as an example. They always move in groups. They are partners in crimes, if I must quote that. So immediately one of them started, let's say they ate fish from the same position last night, and then as they got home, one of them is feeling disturbed. The first thing they want to do is they'll call the next person. That fish that you ate, are you feeling any problem? It is giving me a headache. You're giving me running stomach. It's giving me this. The person will confirm that yes, I'm feeling this or not, or and stuff. Or that restaurant that we ate from, do you feel, I think that food that we ate is disturbing me? So it is easy for them to always have that communication if they ate that food together. So it's good for us to get that information as part of our investigation strategy, so that we already do what? Identify how many people are implicated, so that we can do what we call a case definition. And then we also find if we identify uh, then through that line, we could now link a particular exposure source, or we are having 2 or 3 different people reporting parallel, and then we trace them back to that common spot where they ate that food. Either ways could lead us there. Then we can also confirm the date of exposure. When did you eat this food? And if it is looking like the same day, then it will help us guide that maybe it's a contamination that occurred that day. It's not a common occurrence. And then, of course, if we remove that particular foodstuff from the market, it might contain the spread. But if it's a common occurrence, then we may have to stop by that place altogether. The people you are supposed to interview have to be identified as soon as possible. Remember, we're talking about a disease that appears within hours and present very varying conditions that could perpetuate spread of the disease. So we need to track it very fast to be able to contain the spread. Then second, it is possible that the victims can forget. Okay, the patients are already feeling funny. So it's possible that they can forget a lot of information. So as soon as you meet them, try to get the information so that recollection problems should not interfere with the accuracy of us getting the right information and the right foot implicated. So as soon as you meet, get the information from the patient. The next thing to do is to do a laboratory investigation. So after getting a questionnaire directing you to a particular food and a particular area, you will do a laboratory investigation of the specimen. You could collect feces from the victim or vomit and analyze. You could go to the food area where the person ate from, collect specimen from the area and analyze. So I'm saying that you don't only end your investigation with the patient. If the patient has led you to a particular location, then you must have an environmental visit. If you are working in Bamenda and the patient said the food was eaten in Melon, you have to let the Bamenda District Health Service link up with the Melon District Health Service and other collection of specimen from that position. You don't delay in collecting specimen either from the patient or from the area of contamination, because As I indicated, the person can take antibiotic and will not be able to get the results that we need. So specimen and analysis from a patient now will be useless. Secondly, the foodstuff that was implicated in the could have been discarded. So if we don't do an immediate contact of the environment to collect the food, it could be disposed of, or they could buy all. Imagine that it is all bought. The bigger magnitude of the problem that we'll be dealing with. So it is important to act and act fast, collaborate with other laboratories. If you are within the area, go straight to the field, collect the sample. If you are not within the area, link up with your liaison service in the district concerned and let the sample be collected immediately before it is disposed of or totally used up. Don't forget to protect yourself. I don't need to emphasize on this. Don't forget to protect yourself when doing analysis. You are doing analysis to save life, not to take away your own life. So ensure that you are appropriately apt, you have gloves on, you have, if necessary, a mask, and so on. Protect yourself and have the adequate personal protective equipment so that you don't end up infecting your own self in the course of investigating an outbreak of an infection. So the next point is that if the source of the outbreak is a workplace, if the source of the outbreak is a workplace, you need to move to the workplace, interview the employers, interview the employees, find out if they have eaten the same food or they have eaten food from the same place. What is the food and what quantity was consumed from the spot. From there, we can have an idea if, again, the food is implicated or it is the area that is implicated. When you have all of this, we need to do what we call data analysis and interpretation. We have a questionnaire, we've collected samples, we are able to confirm a particular pathogen in that sample. But it is not enough for us to formulate a policy. Okay, no, formulate policy. So we need to do what we call formulation of a hypothesis and testing the hypothesis. So we need to do extensive research, taking so many samples over repeated time intervals from that same location or from that same foodstuff to be able to say accurately that this foodstuff is implicated in an outbreak. This foodstuff could be a potential source of outbreak, or this vendor is implicated in contaminated food, or this vendor could be a potential source of foodborne disease outbreaks. So to be able to make statements that we need a policy or initiate a policy formation, we need to do an extensive investigation of the case and then confirm our hypothesis without doubt. That is very necessary, especially if it has to affect policy. So that is it about foodborne outbreaks and investigation. But I want to talk a little bit about what we call laboratory-based surveillance. This is still part of the investigation process. But the difference with laboratory-based surveillance here is that we want to routinely monitor the appearance of an outbreak in a system. If you look at the lecture I just presented on the role of the laboratory, a patient reporting to you, you confirm that 2 or 3 of them are having the same symptoms, and then you trace it back. That's what we call laboratory surveillance. There are 2 types of surveillance systems that exist in laboratories in Cameroon. We have what we call passive surveillance and we have what we call active surveillance. As I indicated, weekly, you will report data to the DH2 Earth system. This is what this is the one for Boya. This is the one for Boya. So you see Ministry of Health, Cameroon, District Health Service Information System 2. So National Health Information System. So this is a Southwest molecule. So I already have lock-in details to this. So if you look at it, let me take a particular case and we analyze. This is Access Care Clinic. So I want to open information for weekly reporting. So this is weekly reporting. So I take what? I could take week 42. So each year is broken down into weeks. So at the end of each week, so every Monday, this system is filled, the database is filled. So now they have set the type of illness, how many cases did you identify, how many of those cases died, do you have any comment? So you have chikungunya, cholera, dengue fever, all the common diseases that you know exist, yellow fever, typhoid, meningitis, dog bite, snake bite, malaria, all the different diseases that you think that exist that are tracked under surveillance system by the Ministry of Public Health are identified here. So you report it. When you report it, you submit. Immediately submit, it appears in the National Health Service system. It appears there, and then you are able to know which diseases were captured across the country. Yaoundé is able to know which diseases were captured across the country for that week. So why are we doing this? If they realize that there is a surge in a particular disease, if they realize that, for instance, there is an uprising in the number of malaria cases from the normal reporting that we have every week, then there will be a cause for concern that maybe we have an increased incidence of malaria than normal, and then they might start trying to investigate what the incidence or what is the cause of the incident. Another point is that if they realize that there is a case of cholera reported, there's a case of cholera, because under normal circumstances, we should always have 0 cases of cholera. So if they realize that there's a case of cholera reported, they automatically declare an outbreak in that area. So there's a difference here. I'm saying that for malaria, we expect to always have malaria cases. But when there's an unusual increase in number of malaria cases, it is a cause of concern. If there's an unusual increase in number of typhoid cases, it's a cause of concern. So we are in an endemic area for malaria and typhoid. So we always expect to have malaria. But when they suddenly surge up, there is what we call an outbreak in those diseases. But a disease like polio, a disease like cholera, a disease like yellow fever, that are under elimination target, a single case of those diseases reported in this portal is what we call an outbreak. So what are we saying? We're saying that under the typical laboratory surveillance system, as soon as you identify a case of cholera, you don't wait to report, but at the usual weekly reporting, you need to report immediately. Immediately identify a case of yellow fever, you don't wait to report on Mondays. You need to report immediately. Immediately identify a case of polio, report immediately. So there are diseases that have been targeted for elimination and eradication in Cameroon. Those diseases have to be reported immediately. Meanwhile, diseases that are endemic in Cameroon, we just have to report weekly. And if there's a surge, responsive action has to be taken by the Ministry of Public Health to contain the spread. So that's what we call laboratory-based surveillance, which is passive. But we could also have an active surveillance system. In an active surveillance system, we are going to request laboratories to submit. We are not waiting for laboratories to routinely submit. We are going to ask laboratories to submit that information and actively submit. That is when, especially, an outbreak is suspected. When an outbreak is suspected, laboratories are mandated to actively submit daily data so that they could trace, contain, and prevent the outbreak. So you could go further to read disease definition. I don't think this is an issue for me to give a lecture on. With that, I will end the recording and we go on for further clarifications on things that